Shortly after the inquest reported on the death of Sean Rigg, the Commissioner asked Lord Adebowale to come in and see him because he was really concerned that this sounded a bit too much like a story we'd heard before, which is that a young black male in mental health crisis comes into contact with the police and ends up dead. You will, I know of the case of Olaseni Lewis, who was a young black male with a very limited mental health history, who was in a place of safety where police were called, he was restrained and he died. And you will all know many other cases where police restraint has led to death. Now, my perspective as a police officer, and you would expect me to say this, is that I don't believe any of my officers would ever go into an environment where they intended to cause death. You would expect me to say that, and I have to believe that because otherwise I could not possibly hope to evoke change in my organisation. But what I do think is that our officers are not equipped to understand what they're facing. They're not equipped to understand where somebody is in fear as opposed to angry, and they're not equipped to be able to refer people before they even get to that point of crisis. And from my perspective, real success in mental health care will be when we treat a 136 assessment as a critical failure of service. Because as far as I can see, if we accept the fact that 1 in 4 people will suffer from a mental health illness, and that is even more prevalent in deprived communities where there is little access to a future hope, either through education or through housing or through work, and we know which communities that affects even more than others. If we don't accept the fact that people need access to service early and a referral to service early and therefore don't get to crisis, then we won't change the process that we're in at the moment, which is the police step in at the last possible moment when somebody is at their most vulnerable. Lord Adebowale looked at 55 cases, and of those, 50 concerned death. 20 of them were about people who'd committed suicide either soon after police contact, having been arrested or having been involved for some reason with the police. 5 of those were deaths following either custody or restraint, and a number of others were deaths or serious injuries following contact with police. But every case, every single case, involved some form of either critical or near critical mental health illness. Now, Lord Adebowale looked through all of those cases with his team, and he came up with a number of recommendations for the Metropolitan Police. And if this report will affect how policing interacts with mental health services and with communities nationally. And the reason for that is because Simon Cole, who's the Chief Constable for Leicestershire, is the Association of Chief Police Officers lead on mental health, and he was part of the panel. So Simon knows exactly what was discussed, what was thought through, and he has been able to inform Lord Adebowale and the team of what's happening on the ground in policing, and some of the things that we face in terms of not being able to get access to support services, not being able to question why it is that we're being called into places of safety. And there's a bit of reassurance I can give you about the Metropolitan Police, certainly, which is that last year, between October 2011 and November 2012, of 249,950 custody cases, only 55 of those were people who were brought in as mental health places of safety. So I can give you that commitment from the Met's perspective that we are not going to use police stations as places of safety. There are always going to be times when restraint is necessary because somebody may be so violent or so dangerous or armed with a weapon that restraint at that point is the only way to keep people safe. And remember, the primary function of policing is to save life, and that is our primary function. And if we don't get that right, then we are breaching our trust with you, and we are breaching the reasons for being there. But it's not always in our hands and in our gift solely to be able to prevent that from happening. And I don't think we can honestly say to any of you that we've got it right consistently, because you know perfectly well we haven't. And there's lots of reasons for that. But I think one of the reasons is that we don't understand the differences that occur across the mental health spectrum in different communities, because we're not engaged sufficiently either at practitioner level through our healthcare trusts, or at practitioner level, right at frontline policing, to understand the differences between a predominantly African Caribbean community in the poorest part of London and somewhere like Richmond upon Thames. The interesting thing though is that for both those areas, the same commissioning process will apply around how we access mental health care services, both at community, third sector and trust level. The other issue for me, I guess, is how we assess vulnerability. And I don't think we're very good at that, in all truth. I think police officers are very good at what we call risk assessments, but for me, mostly a risk assessment will occur after something has happened. When everything's done, we then look back and we say, well, did we cover that risk? Did we cover that risk? Did we do that? I don't think that's good enough. And what I want to introduce, with the help of people like yourselves and with the help of the College of Policing and others, to introduce a vulnerability assessment framework. And that basically means that in every single interaction that we have with the public, be that a call receipt, be that when we're out on the street, be that talking to people who are the victims of crime, or even suspects in custody, I want to be able to assess there and then what their needs are that make them either vulnerable and in need of immediate referral to something else, or vulnerable and in need of further and ongoing case management care between ourselves and other agencies. Because, let's face it, we are in a horrendous area now for austerity. You've heard today from various individuals in the room about the number of cuts that are coming, and there will be more. How are we going to deliver this better service then, at the same time as making those cuts? Well, we're not if we don't do it together, and we're not if we don't get upstream of the problem. And if you think that 1 in 4 people suffer from mental health issues, if you understand the statistics that tell you that 70% of the prison population have suffered at least one significant mental health issue in the past 2 years, actually that means that mental health is impacting a huge amount of cost into the criminal justice system. Imagine we could get to a place where you reduce the demand on policing and courts and you redivert that money back into mental health care. That's what we should be aiming for. And I hope that some of the work that we're going to be doing, both at London, South Region and national level, to really look at how we case manage people who are at risk because they're suspects, because they're victims, or because they're simply people in communities who are vulnerable to others because of their mental health conditions. If we can get those partnerships right, if we can understand when we need to escalate our activity, to intervene, to stop somebody from getting to that critical point, the critical point where their police officers are coming across people in the street with whom they can't communicate, and about whom perhaps they don't understand enough to be able to respond in the best way. And I still think this is about understanding the difference between fear and anger. If we don't get to that place, then we're not going to change the landscape for you. We're not going to convince any of you in this room that there's real confidence in the way that police deliver their services, and we're certainly not going to convince you, and I'm not going to convince you, that this organisation does care about people. And actually that's what we're there for. We're there to keep you safe.
How do they propose in the future to encourage service user involvement? I've found today very intimidating. There are many carers and providers, etc. present today, but not many service users. I want service user focused events. So it's a young man who feels intimidated here. Imagine how intimidated he may feel in a forum with police officers. Can you respond to that?
Well, I think it's a really good point. You know, the last thing that somebody in mental health crisis wants to see is a load of uniforms stealing towards them. I can't think of anything more terrifying than that. I think there's 2 things. The first issue is, how do we coordinate activity between the local mental health trusts, outreach work, crisis management, escalation management, and communities and what communities need, which are all going to be different across London. And of course, part of that has got to be fundamentally understanding communities and the patient community that sits within it. So for me, that's almost about having I suppose, the structure that I want to introduce around the policing and management and information exchange and control and all the rest of it, and accountability about what police do at local level. But I think it's also got to be something around the independent advisory groups that we set up around each of the healthcare trusts, with patient user groups, because I think probably one of the most impacted services that impacts in the wrong way for patients is policing. And it's not always the case that we get it wrong. Sometimes we get great feedback. Sometimes police officers will turn up to somebody in crisis and they do it right. but it's not consistent. And we've got to get that empathy into policing so that actually we approach everything with understanding that we're meeting somebody who's potentially vulnerable rather than that we're meeting somebody who's potentially a criminal. Because actually most of the people we come across are not criminals. They're the people of London that we're there to protect.